Good evening. I'm Trina Jones, and I'd like to welcome you to the second webinar in our series entitled COVID's Compounding Inequalities. Thank you so much for joining us. The series is designed in part to examine the effects of COVID-19 in a variety of different areas in our lives. Last week, we discussed voting rights. This week, we're considering COVID's disparate effects on marginalized populations and possible solutions to the structural inequities the pandemic has highlighted. I want you to know that we're recording the event, and if you have any questions, please pose them in the Q&A button at the bottom of your screen. We have a truly outstanding group of esteemed scholars and activists with us. I'm so excited to introduce them to you. You have seen their full bios, so I'm just going to briefly go through their histories. Theodore Shaw is the Julius L. Chambers Distinguished Professor of Law and Director of the Center for Civil Rights at UNC Law School. Among his numerous critical contributions to social justice, Professor Shaw served as the 5th Director Counsel of the NAACP's Legal Defense Fund, and he drafted the introduction to the DOJ's report on police practices in Ferguson, Missouri. Angela Onwuachi-Willig is Dean and Professor of Law at Boston University School of Law, and is a renowned legal scholar and expert in critical race theory, employment discrimination, and family law. She is the author of According to Our Hearts, Rhinelander versus Rhinelander, and the Law of the Multiracial Family. Nina Kohn, a leading expert in elder law, is the David M. Levy Professor of Law and Faculty Director of Online Education at Syracuse University College of Law, and a faculty affiliate with the Syracuse University Aging Studies Institute. She is the author of Elder Care, Practice, Policy, and Problems. Saru Jayaraman is the president of One Fair Wage, co-founder of the Restaurant Opportunity Centers United, ROC United, and director of the Food Labor Research Center at the University of California, Berkeley. She is the author of Behind the Kitchen Door and Forked, a New Standard for American Dining. Rinku Sen is a senior strategist at Race Forward, having formerly served as executive director and as a publisher of their award-winning news site, Color Lines. Her books, Stir It Up and The Accidental American, Immigration and Citizenship in the Age of Globalization, theorize a model of community organizing that integrates a political analysis of race, gender, class, poverty, sexuality, and other systems. César García Hernández is an associate professor at the University of Denver Sturm College of Law. He publishes Crimmigration.com, a blog about the convergence of criminal and immigration law. He is the author of Crimmigration Law and Migrating to Prison, Americans' Obsession with Locking Up Immigrants. And finally, last but certainly not least, Ravi Ragbir is the executive director of New Sanctuary Coalition, a multi-faith immigrant-led organization that creates support systems for and empowers those navigating the immigration system. A long-time permanent resident of the United States, Ravi has been targeted repeatedly by ICE for his activism. So what I'm going to do is to present each of our esteemed guests with a question, and we'll talk for a few minutes one-on-one, and then we'll open it up for a panel conversation about solutions and intersections. So let me start first with Nina. Nina, as of July 22nd this year, over 2/3 of all US COVID-19 deaths have been among persons 65 years and older. The virus, we know, has ravaged nursing homes and long-term care facilities. People living in nursing homes make up less than 1% of the US population, yet they account for approximately 40% of all COVID-19 deaths. Is it a foregone conclusion that older persons will suffer disproportionately because of the ways in which the virus interacts with older bodies? Or are these disparate outcomes shaped in some way by societal views and by the regulatory framework in which long-term care facilities operate?
Well, thanks so much for having me here. I think the answer to that question is yes and no. Of course, older adults are more susceptible to severe outcomes from the virus, but the extent of infection that we're seeing among older adults, the degree of COVID-19 related suffering, those aren't foregone conclusions. And rather, what those are really the result of political and social choices that we've made as a society about how we value older adults and how we care for older adults and who cares for older adults. So for example, you were talking about the disproportionate impact of COVID-19 on long-term care facilities. Well, one reason for that is that long-term care facilities were infection tinderboxes well before COVID-19 began, because policymakers and providers have long accepted really dangerous conditions in them. So even among those nursing homes that were given a 5-star rating by the federal government pre-COVID, more than half of those had recent infection control violations. And yet, enforcement in the nursing home area rarely amounts to more than a slap on the wrist. I mean, the federal government has never instituted the minimum staffing standards you would need to prevent systemic neglect in these facilities. And even amid COVID-19, when you think, okay, here's the opportunity, let's really get serious about enforcement and safety, what have we seen? We've actually seen the federal government doing the opposite, scaling back enforcement efforts, suspending most inspections, I should say, and also waiving some of the key regulatory requirements. And I think what's interesting about that in part is that if you look at this tolerance of suffering in long-term care facilities, you have to ask, well, what accounts for that? And I think if we look at that deeply, we can see that implicit in that is an acceptance of this ageist notion that older people's lives are just not fully worthy of protection. And we're seeing that too in the indifference amid COVID to the widespread acceptance of isolation of older adults, right? So we see the reckless opening up of America is forcing older adults into greater isolation. And this isolation is particularly visible, actually I should say it's particularly invisible, right? In long-term care facilities, in nursing homes, where residents remain largely imprisoned. And what do we see the policy response being to that? Well, we see the Centers for Medicare and Medicaid Services, which is the federal agency charged with protecting the rights of nursing home residents, actually condoning facilities' practices of barring visitors because they're understaffed, rather than, say, requiring facilities to have the staff they need to allow for safe visitation, to allow nursing home residents to exercise their basic First Amendment rights. So we have this devaluation that's becoming very visible of the lives of older adults, but I think it's important to understand that the risks that older adults face, and I think this is part of the theme of today, also reflect the devaluation of lives of other people, and in this case, especially of direct care workers. So we see that low pay of direct care workers is leading many to hold multiple jobs in the long-term care industry, bringing infection from one to the other. Lack of sick leaves and benefits means that people have to come to work sick as a practical matter. And you have staff then in these facilities being ideal vectors for the virus. So one thing the epidemic has exposed, I think, is that the interests of care providers and care recipients are truly aligned in many ways. Now, of course, the long-term care industry for a long time has tried to sort of suggest otherwise, right? To create the zero-sum game for people that, well, you can't pay workers more because older adults need affordable care, or workers can't have benefits because then we'd have to take resources away from older adults. But COVID-19, I think, gives us this very good example of why policies that put workers at risk put care recipients at risk, and that the structural racism that has created this marginalized, at-risk economy of care now is contributing to the death and suffering of the people who that care is to be provided for. So let me stop there. and turn things back.
I appreciate those comments, especially the way in which you teased out the bias dimension, right, in terms of what's happening, right, the scaling back of enforcement and monitoring what's happening in these spaces, right. I wonder if we might spend just one more minute talking about the ways in which long-term care is actually funded by the government, because I think that there is some data to show that there are disparities, right, depending upon how a facility, how wealthy, right, the residents of a facility are in terms of the quality of care that one receives. So could you talk about the funding structure, because that may be one of the structural barriers, right, to change?
So that's a great question. So the majority of nursing home care in this country is paid for with federal funds. The majority is Medicaid funding. Increasingly, Medicaid funding is also going into the assisted living industry as well. So the federal government really does have a big interest, one would think, in ensuring quality of care. You know, where we're seeing a big difference in quality of care is actually the difference in ownership status of the facility. So what we're seeing is that privately owned facilities, and there was research showing this even before the epidemic, have a statistically greater risk of more deficiencies in quality care. And what's actually quite interesting is this is not a US specific problem. We're seeing this in Canada. We're seeing this in the UK. Yesterday, a really horrific set of stories were coming out of Australia about the same pattern, because long-term care is being used as a place for profiteering. And when the people who are have care provided for don't have a voice by and large and aren't able by and large to advocate for themselves, and families are often not there as well, that's part of the reason for institutionalization, then that profiteering comes at such direct expense of individuals. So when we think about structural barriers to quality care, it's increasingly becoming clear across jurisdictions that there is a very disturbing linkage between ownership status and quality of care. And we're also seeing a linkage in size of facility and quality care.
Thank you, that's very helpful. Maybe we can come back to this question of privatization as well as invisibility when we start talking about some of the connections between the various areas that we're going to be discussing over the next hour or so. Thank you so much, Nina. Saru, let's shift our focus to workers. And as Nina has already pointed out, many of these issues are interrelated, right? So you have older persons who are more vulnerable, right, in this moment in lower tier facilities, but you also have lower wage workers operating in those facilities and are at risk as well. We know that Black and Latinx workers make up nearly half of the direct care workforce in long-term care facilities. These and other low-wage workers, like employees working in meatpacking plants, as grocery store clerks, as delivery persons, have borne the brunt of risk associated with the pandemic. They're labeled essential, yet they're treated as expendable or disposable. So these workers are essentially in a catch-22, forced to choose between earning a living and their health. Could you help us to think about this catch-22 and the tension between worker safety, right, and the desires of Americans to receive their daily Amazon deliveries, to shop in retail stores, and increasingly to dine out?
Yeah, definitely. And thank you so much for including me in this great panel. Really appreciate it. Yeah, I mean, I don't think people understand the catastrophic level of the crisis for low-wage workers, both the number of low-wage workers in America that are struggling right now and the severity of their crisis. You mentioned healthcare workers, you mentioned retail workers and restaurant workers. Those three happen to be the largest industries of low-wage workers in America. Prior to the pandemic, you saw healthcare being the largest of the public sector low-wage workers, and then restaurant and retail being the two largest of the of the low-wage workers among private sector workers. And together, you're talking about a good 30 to 40% of the entire United States workforce that had been living at or near poverty level wages prior to the pandemic. And so I think what's important to understand is that the pandemic didn't create income inequality or the situation that most of these workers are in. Frankly, a huge swath of American workers were struggling with just barely making ends meet, and the choices between taking a day off when you're sick and putting food on your family's table long before the pandemic just made it all very clear. And I will use the service sector and the restaurant industry as an example of this, just because it's the one I know the best, but this is certainly a conundrum that's being faced by millions beyond the service sector. The restaurant industry was 13.5 million workers prior to the pandemic. It was already the lowest wage sector of any, even lower wage than retail or home health care, frankly, the lowest wage sector in the United States, period, prior to the pandemic. And that was largely due to the money, power, and influence of a trade lobby called the National Restaurant Association, which we call the other NRA, and which represents the chains, the IHOPs, the Denny's, and has been around actually since emancipation of slavery. And I think it's so important in this moment to lift up these histories, because tipping as a practice had originated in feudal Europe. It was something that aristocrats and nobles gave to serfs and vassals, but always on top of a wage. It wasn't until right around the time of emancipation that this practice of tipping came to the United States. And when it did, at emancipation, the restaurant lobby, the predecessor to the National Restaurant Association, demanded the right to hire newly freed slaves, mostly Black women actually at the time, and not pay them anything and have them live entirely on this newfangled idea that had just come from Europe at the time called a tip. Now, the irony of it is that tipping originated as an extra or a bonus, but became a replacement for a wage because of slavery, because of Jim Crow America and the desire of restaurants to just not pay Black people, and particularly Black women. And so that became law in 1938 as part of the New Deal, when everybody got the right to a minimum wage, except for groups of Black workers, farm workers, domestic workers, and restaurant workers, who were given a $0 wage as long as tips brought them to the full minimum wage. And we went from 0 in 1938 to $2.13 an hour, which is the current federal minimum wage for tipped workers in the United States of America, in the largest workforce of low-wage workers in the United States, and almost the largest workforce, period. And so you're talking about 13 million workers struggling on $2 and $3 and $4 wages. 38 states have wages of under $5 an hour. And that was all prior to the pandemic. Prior to the pandemic, you're talking about a majority female workforce of single moms struggling to make ends meet on tips, and struggling with the highest rates of sexual harassment of any industry, because they're having to put up with all kinds of inappropriate customer behavior to feed their families in tips. Pandemic hits, about 9.5 million restaurant workers lose their jobs. We started a fund on March 16th for these workers, an emergency fund, raised about $23 million. 200,000 workers applied to the fund. 60% of them reported that they were unable to access unemployment insurance because their states told them their sub-minimum wage of $2 or $3 plus tips was too low to meet the minimum threshold to qualify for benefits. And so essentially these states that had refused to raise these workers' wages prior to the pandemic turned around and then blamed those workers for having those wages by denying them benefits that, by the way, they had paid taxes to get. And so we saw millions, literally millions of workers unable to access state benefits when federal benefits came through. And of course, now they're on pause, but when they came through, many of these same workers were unable to access those federal benefits because they came through the state systems and the states had already denied them. And so they were unable to reverse state denials to access that federal funding. And so 4 months ago, when we started this fund, workers were telling us, I am so glad to have this money to pay for groceries for my children. At this point, many of those same workers are telling us, I am now preparing to steal food for my children. And many of them are sending us pictures of their electricity bills and saying, I don't know how much longer I can be in touch with you because my internet and phone is about to go out. I'm about to lose my home. And you're talking about 13 million people. So I just don't think people understand the scale or the severity of the crisis. On the other hand, there is this incredible moment of opportunity where it has created this horrible, as you said, decision for people. Do I go back to work? I'm being called back to work for a $2 or $3 wage. Tips are down 75%. Do I risk my life or the life of the person living with me, my elderly parent or my child, to go to work for a $2 job when there are no tips? Or do I say no to this job? And the opportunity is that so many workers right now are saying, no, I am not going back to work for a $2 or $3 job, that and facing starvation. But that refusal to go back has led literally hundreds and hundreds of independent restaurants to decide to change their wage practices. I cannot tell you the number of restaurants and said, we think it's time to go ahead and change and move to a full livable minimum wage. And many of them are now coming with us to state legislatures. People who fought us in the past are coming with us to state legislatures saying, we actually believe now is the time to change the law to move to a full livable minimum wage. So I could say a lot more, but there's just incredible opportunity right now in the face of devastating crisis.
Well, we would love for you to come back and join us on another occasion to say more. But I thank you for that history, and thank you for also the good news. The law students in the audience will appreciate the fact that I'm about to present you with a hypothetical, right? And I think that this hypothetical underscores some of the difficulties that workers are encountering. So let's assume that you have Keisha, who works as a grocery store clerk in a local food store. She's 35 years old. She lives with her grandmother who has diabetes. And Keisha's afraid to go to work, not necessarily because of the risk to herself, although there are risks, right? But because she may contract the virus and go home and infect her grandmother, right? If in a right to work in an at-will employment state like North Carolina, Keisha may have very few options, right? There are certainly federal laws in place. The American with Disabilities Act will provide some recourse if you in fact have a disability, but Keisha doesn't have a disability, right? Then you have the Family Medical Leave Act, which provides some leave time to care for a relative with a serious medical condition, but her grandmother has diabetes. It's not clear that she has some imminent serious medical condition, and that would fall within the parameters of the FMLA. And more importantly, if you are a low-wage worker or employee, unpaid leave doesn't really provide you with many options, and that's what the Family Medical Leave Act provides. And then you have OSHA, right, which is supposed to guarantee safe working conditions for workers, but we've seen some of the limitations and the failure of OSHA to actually set forth anything more than advisory guidelines in this moment. So what is a person like Keisha, right, supposed to do in this moment? Do I have the analysis correct in any way? What would you advise?
Sadly, you do. And even the limited rights that she might have, I think people need to understand the real limitations for somebody like Keisha to actually have her rights vindicated. So everything you said is correct. If she works in a grocery store, she is unlikely to have any recourse at all. I was going to say, even if she was a restaurant worker and she decided to go to work and she was working for $2 and tips didn't bring her to the full minimum wage, federal law says the employer is supposed to make up the difference. But right now, under this administration, there is zero enforcement of that law or willingness to enforce that law. And I'm sure you're hearing the debates among the Republicans right now. They're actually trying to introduce zero liability for employers in general for workers like Keisha. So there's nothing that she can do from a legal standpoint. There is a lot she can do it from an organizing standpoint. And that's why I was saying to you earlier that I'm an attorney, but I'm also an organizer. And there's so many situations like this where the law just isn't going to provide. And what is going to provide is workers coming together and standing up and frankly exercising their rights to free association, to organize. And Keisha does have the right to organize. That's still a right that we have, unless she's an undocumented worker. And even then, there are some rights that she has. And so we actually are organizing. We've been organizing strikes along with many other worker organizations. We got one for the end of this month. And that is something Keisha can join in and do because there are no legal recourses for her in the hypothetical you presented. It just shows the importance, I think, of law students thinking not only about all the different ways that we can enforce the law, but frankly, law students thinking about the ways that they can support social movement activity and organizing for workers to actually change the law so that new rights can be made, and also so that workers can stand up and not be retaliated against when they do.
Thank you so much, Saru, for the intersectional component of that history. I think we all need to pause and really think about $2.13 and what that means, right? And also combined with wages, there is the absence of benefits, which I was hinting at when I was talking about the Family and Medical Leave Act. So there's income inequality, but there's also a dearth of benefits that we also need to consider. Thank you so much. Angela. I'd like to shift gears, but not really, because there is a correlation between class and race. But not only has class played an important role in how individuals are situated in the pandemic, so too has race. In early July, in data obtained from the CDC, the New York Times reported that Latinx and African Americans in the United States are 3 times as likely to become infected as their white neighbors. And Black and Latinx people have been nearly twice as likely to die from the virus as white people. The numbers are even more dire when you consider what's happening with Native Americans, particularly the Navajo Nation. Would you talk to us a bit about the racialization of the virus itself?
I think you see a couple of forms of racialization. On the one hand, you see the racialization of people as other, as deviant, as diseased, right? And when we see this in particular hitting Asian Americans and Asian migrants, in particular Asian international students here in the United States. Who are being blamed for bringing the coronavirus, the COVID-19, to the United States. You see it in how our president references and the media references COVID-19 as the Wuhan virus or the China virus. It gets associated with a particular group. And then that group gets blamed for that, for the virus, and then we see a lot of violence that's being perpetrated on American citizens as a result of all those racial stereotypes being opposed. So that's one aspect of the racialization here. The other aspect is sort of a newer form. What we see is racialization being really tied to what people call culture, not really culture, but that people are suffering, or that the disparities are the result of the bad culture of particular groups, right? So for example, that Black and brown people are dying from and are getting the coronavirus or COVID-19 more frequently because of bad culture, because of the way that Black people eat, or because Black people aren't taking it seriously, or because brown people aren't taking it seriously enough. And there's really a focus on blaming people and their behaviors or their culture for that, as opposed to sort of thinking about the systemic reasons why particular groups might be the victims of this virus more than whites, right? And so not thinking about, for example, the very important things that others have been talking about, more likely to be essential workers, more likely to not have an option of being having the choice to stay at home and to work remotely, and to be socially and physically distant from others. They're ignoring the lots of evidence about discrimination in the health field, discrimination by doctors. I mean, how many stories have we seen of Black and brown people who've gone to the hospital begging to be helped? They've had the symptoms of the coronavirus, and a white patient comes in and is rushed in and is tested and gets treatment, and the Black patients or the brown patients are absolutely sent home, right, and told that they actually don't have it, or that they're unlikely to have the coronavirus. Are more likely to have to take public transportation. I mean, so people aren't really focusing on the economic, the very structural reasons why particular groups are more likely, the very racism why more particular groups are more likely to suffer from COVID-19 and to die from COVID-19 than others. And that's the other form of racialization that we see happening here.
Thank you so much. Thank you for pointing out the ways in which racialization processes are similar across groups, but also differ, right? So as people are becoming increasingly aware of the disparate effects of COVID on Black and brown people, right? And as Trump continuously uses the phrase, as he did in his press conference this evening, China virus, right? You have increasing animus against Asians as well, right? And so there's this idea of disease, right? Permeating people of color, but then there's this added dimension when you are engaging Asians, right? And that is this idea of being foreign. Do you see that playing out in this particular moment as well?
Oh, absolutely, right. So that number one, that the disease came from somewhere else. And that also, we see it in particular in the attacks on Asian Americans, right? That Asian Americans are othered as foreign, as not American, as attached to this virus that came from someplace else and are therefore to blame for it, right? Absolutely, the perpetual foreigner, right, and one's own land and one's own country is very much part of this narrative and part of this story in terms of the racism of the coronavirus.
Yeah, yeah, and thank you also, Angela, for pointing out what Barack Obama observed in Dreams from My Father, that when you see people of color behaving in a particular way, right? Not socially distancing, right? Perhaps not wearing a mask, right? Then people assume, right, that all people of color, or all African Americans are like that, right? So if you see one African American who's not socially distancing, who's not wearing a mask, who's in a bar, right? Then people make this assumption that, well, all Black people or African Americans are like that, right? Or Latinx individuals as well. And what Obama said was that only white culture has individuals, right?
Yes.
Do you want to tease that out a bit?
No, absolutely. And my new colleague, Ibram Kendi, who we're excited about at BU, has made this very argument, right? That you know, one of the things is, of course, that whites get to be individuals in the way that people of color don't get to be individuals, right? And that the actions of Black individuals get attributed to the entire race, that the actions of Asian individuals get attributed to the entire race, and so on. And we see this also too in the way that things get policed, right? That the people get policed around their compliance with public health guidelines, right? So if you look at all the data on who's getting charged or arrested or fined for not wearing a face covering, it's all showing that almost all of them, you know, 90% or more are targeted towards people of color, in particular Black and brown people, right, for not wearing masks. You've seen lots of pictures of, you know, you could see whites who are sitting in parks without their mask, you know, having a picnic or enjoying themselves. And then you see, for example, a Black person who's being held down by the police and being roughed up for presumably not wearing a mask. And so you really even see the effects in the policing. So the stereotypes are not just there, but they have a real consequence, right? Because here they are being internalized, right? I mean, there are lots of stereotypes that are being internalized by people like police, but here they are being internalized by police, and they're having a real impact on enforcement. It's really interesting, you know, Miami, the city, actually announced they were going to begin fining people for not wearing face coverings. And I remember when I heard that they were going to begin doing that, I remember thinking, this is going to be very much like Ferguson, where they're going to be focused on particular communities. And this is going to be a way of making money off of the poor, they're going to be policing mainly communities of color, looking to see who's not wearing a face covering, finding those communities, right? And then using those, when people don't have the resources to pay those very hefty fines, then using that as a reason to then toss people in jail and starting all those cycles again. I remember precisely thinking that it would be very interesting to have people begin to really, really closely examine and see what cities that are using fines now for non-compliance with face coverings. Where are they watching? Where are they observing? Who are they fining? Where are they more likely to be sort of patrolling? Who's bearing the brunt of it? And what are the consequences in terms of incarceration?
So not only are there these spillover effects in terms of individual actions and assumptions about the group to which the individual belongs, but you're saying we need to pay attention to what happens in terms of enforcement, right? And who gets criminalized or arrested for non-compliance. There's an added dimension, and maybe we can come back to this later, and that is who gets to wear a mask, right? Freely in our states, right?
Absolutely.
If you're a Black male,
absolutely.
should you be wearing a mask? You know, can you freely wear a mask in public, right?
Absolutely.
Yeah. So we'll come back.
And what kind of mask, right? You even hear about people making choices about the kind of mask they wear, the color mask they wear, so they will appear less threatening, or people will report them for things more, or less likely to report them for things. And we know people have been reported as being suspicious for actually complying with public safety guidelines.
Yeah, yeah. Thank you, Angela. Ted? I'm wondering if you might pick up on this topic of race. Angela hinted at this a bit in her commentary about the ways in which if you could tease out some of the ways in which the pandemic has exposed underlying systemic racial inequities, right? So she talked about differential treatment in terms of the provision of healthcare, right? There are also issues with regards to access to healthcare, who is insured and who is not, and the racial component to that. So could you talk to us a bit more about some of the ways in which the pandemic has exposed underlying systemic racial inequities? And then I have a second question for you. I'm wondering if you could comment on the fact that mass protests against racial injustice are occurring in the midst of this unprecedented pandemic. What, if anything, does that tell us about these underlying systemic problems? What can we learn from this moment?
Well, first I want to say thank you for including me in this conversation. I'm grateful for that. Let me start by saying that when this pandemic began to unfold, as soon as we began to hear that underlying conditions, health conditions, were a factor, as soon as we began to realize that some people simply were not going to be able to isolate themselves, it was clear almost from the get-go that this pandemic was going to have disparate impact on Black and brown people. We hear repeatedly that, there are commercials that say this, public service announcements, the news, television shows. We're all in this together. We're not all this in together, not in the same way. In fact, in that respect, it's very much like Katrina. I remember seeing the news stories of all of those long lines of cars on the bridges out of New Orleans, crossing Lake Pontchartrain, going up into the interior of or trying to go to either the interior of Louisiana or west to Texas. And it looked like everybody was getting out. At least that's what a lot of people thought. And it became apparent that everybody didn't get out. And there were tens of thousands or more Black and brown people who didn't have cars, who didn't have a way out. We know what happened. we saw death and further impoverishment. And the impacts of Katrina were impacts not only on health and wealth, but on political empowerment. We can go on and on. And in that respect, like Katrina, COVID-19 doesn't create or hasn't created disparities along lines of race. It has illuminated and aggravated those disparities. And so as we look at workforce participation, who gets to work at home, and therefore who has employment or what kind of employment, who has to go to work on public transportation and serve other people, exposing themselves to the virus. We look at the issues of, more deeply in the issues of housing, and the relationship also between income and the ability to maintain housing. We see all these evictions that have been forestalled for a while, but now we're hearing stories about people being evicted, much less who owns housing, and aggravating the housing ownership, which of course is connected to wealth, that gap. And we can go on and on. Education, who gets to educate their children at home? Who, as I said, who can stay at home? And then what does that mean with respect to what happens to their children? And obviously the health disparities themselves. All of this is very much we're watching this play out, seems like in slow motion, along lines of race. And then when we look at the public discourse, or we listen to the public discourse, certain elected politicians who are in denial. They refuse to acknowledge the seriousness of this illness. I'm not saying it doesn't affect white people. There are a lot of white people who are ill and dying. But some of this is also a reaction rooted in the notion that it's those people, even though they're wrong about that, or it's only those people, even though they're wrong about that. Very much along racial lines. We have to talk about the politics of COVID-19 disparities at the same time that we are in this extraordinary time and dangerous time with respect to political polarization and racism in this country, and how all that is playing out as it interacts with COVID-19. This is a time that no one could have put, or hardly anyone. I mean, there were some people who talked about the danger of a pandemic, but putting this together with, this occupier of the White House now, and the politics of all this and how it plays out, and the racism that is just out front. I'm not sure that many people were able to predict that we could be in this moment, but here we are. We're making a history, or history is unfolding that it's very difficult. It's impossible, really, to look at this with an objective eye. It's kind of like being up in an art museum. If you're right up on a painting, it's right here, you can't see it. You can't understand it. You can't take it all in. It's going to take years to really understand what is happening right now. And in the meantime, we have to address this dual crisis, the COVID-19 pandemic, as well as the virulent racism that we see being unleashed and it's always been here. Some people said it was gone once Barack Obama got elected. It never went away. We knew that, although it was easy to let our guard down. The one thing, though, and it goes to the other question you've asked me, that we also couldn't have foreseen is as the politics of this time unfold, and we have all of these continued repeating deaths of Black people. Most people say Black men. It's not just Black men. It's Black men and Black women who've been killed by the police for decades and decades. A simple statement that Black Lives Matter is something that was met with such hostility and resistance by so many people. But now that phrase is on the lips and the tongues of all kinds of people, including a lot of white people. And the demonstrations out in the street are not just Black people demonstrating, and in many instances, it's majority white, or some places like Portland, there aren't many Black people in Portland. There are reasons for that we all know, the history of Oregon, et cetera. But this is an extraordinary moment. It's a moment when it is much more difficult to gaslight us and tell us that what we experience is not real, because it's all been caught on these devices that everyone has. And so it can't be denied. It's all on here. This is an extraordinary time. We hope that we're beginning to see, or we're seeing the beginning of a paradigm shift in this country. We've hoped for it for so long. With respect to the acknowledgement of white supremacy, people are finally talking about white supremacy and everything that
are happening, right? Black Lives Matter signs are appearing in neighborhoods that one would not have, in 2014 imagined, right?
That's right.
You have that. You have people actually talking about white supremacy. But it's one thing to have a sign in your neighborhood and to use the phrase systemic racism and white supremacy. It's another thing, right, to commit to enacting policies to deal with structural racism. And you've alluded to some of the structures that we need to engage, right, in order to erase some of the disparate effects that we're seeing in housing, in employment, in transportation, and access to healthcare and the delivery of healthcare services. So there's a lot of work to be done as you look to, and I hear some optimism in your voice as we look towards this future that you're contemplating.
Yes, and I know I've gone on too long already. I'm dangerously garrulous sometimes, and so forgive me, but I just want to add one other thing. I live in a neighborhood, I'm sitting in the second floor study in a beautiful house in an overwhelmingly white neighborhood. I can't complain about being locked down. I can't. I am privileged by any measure, and in this neighborhood, overwhelmingly white. Yes, I see those signs, but I'm also always the child of a public housing project in the Bronx, and I've been thinking, I haven't forgotten about it, because I still talk to people I grew up with, and some of them still live where we grew up, in a huge housing complex, a 20-story building. How do people isolate themselves in a 20-story building with 2 elevators? Even when I was growing up, often at least one of them didn't work, sometimes neither one. But even if they work, you get in the elevator, you have to push the buttons. You can't be isolated, social distancing from the people in the building. You get your mail, you come in and out of the building. You're constantly pressed up against other people. living on top of one another, cheek by jowl.
And I think that's very important, Ted, right? Because a lot of the attention has been on comorbidities, right? And the fact that people of color, African Americans, Latinx persons may have more comorbidities, but it goes beyond that, right? Because these numbers seem to speak to more. It's a question of who gets to leave their home, who has to use crowded public transportation, who enters into a crowded workspace where you are forced to engage with the public, or you are closely situated with your coworkers, right? So all those variables play into risk, right? And who is exposed to this virus, I think is really important to keep that in mind. Let me ask Ravi a question, just in the interest of time. And Ted, you're always, I know you're a Tar Heel and you're down the road, but you're always welcome to come back and extend this conversation.
Thank you.
So Ravi, a large focus has been on anti-Black racism this summer, but as I mentioned earlier, the virus has had devastating effects on Latinx and Native peoples as well. You're an immigration rights activist, and you were in New York when New York was an epicenter. Can you tell us what that was like from the perspective of an Asian Trinidadian immigrant and one who advocates on behalf of immigrants?
Sure. So what you see in the background, my background is what happens in detention. You're talking about hundreds of people in detention where it is not even a bed, you're just lying on the floor. But I'll come to that in a second. I just want to answer a question about what happened in New York City when there was this pandemic hit and we were the epicenter. Everyone did follow the rules, but as you heard from Saru and you heard from Angela and Theodore, that it is you have privilege. People who can afford to stay at home, people who can afford to live over the next few weeks or months because they have resources. Many of our communities, brown and black immigrants, citizens who don't have that privilege, who have been working check to check, right? Month to month, not knowing what is going to happen tomorrow. Especially for many of our communities that have just come up. So I work with the immigration community who are seeking asylum. And we help people from all over the world, Africa, Caribbean, Trinidad, Haiti, Central America is a lot of our focus where they have been wanted to
I'm sorry to interrupt you. We're getting a lot of feedback. Would it be possible to disconnect your headphones? Maybe that will diminish it because it's impeding our ability to hear what you're saying, and we really want to hear your comments.
That should not have happened. Okay.
That's much better. Thank you.
I won't repeat what I just said because in the interest of time, hopefully you'll be able to catch some of that. But when you look at the recent arrivals, the asylees, the people who are coming up from Central America, the people who are coming from all over the world, when they come here, they don't know what the process is, what they're doing. And even if they've been here 2 or 3 years, as I said before, as you heard Saru and everyone talk about, they live in paycheck to paycheck. So if you don't work, how are you going to survive? I will say, Trina, that New York City worked with the advocates, worked with us because we knew the problems. And New York City, and this was shockingly strange, were one of the things they did, which was I had to give applaud them about, was they provided food banks for people across the area that was embedded in the schools so that you just come there, you get breakfast, lunch, and dinner. No questions asked, which was shocking because you don't normally have New York City responding in this way for our communities. But when you're talking about, I can stop here, but I will really want to get into the racism, which this discussion is about, racism in the immigration policy. But I would throw it back to you, and if you want me to continue that discussion, I'm happy to do that.
Please continue, because we've been focused on anti-Black racism, right? And not to suggest that all immigrants are in fact brown or Latinx, because there are Black, Latinx persons as well. But I would like to focus on what's happening with racism in the immigration system for a few minutes.
Thank you very much, Trina. You're right. Immigration is not only Latino, Latinx, or brown people. In fact, Haiti, Trinidad, Africa, mainly Black. You're looking at the people who are coming up from Central America. There's a huge land grab right now in Central America, displacing the Garifuna community, which is, I do not like to use the word indigenous because I think it's racist. No one talks about indigenous British people or indigenous French people. They only talk about indigenous Caribbean people, right? Because it is derogatory and I refuse to use it. So I would say First Nation, people who have been there from the beginning are now fleeing their country because there's a huge land grab and people are dying because of this attack to claim their land. But let's look at the immigration policy itself, which you can go back to 1883, where this Chinese Exclusionary Act. If you look at that on its own merit, you know that that is racist because it wasn't about anyone doing something. It is about a person being, and a culture and a community being targeted because of who they are. And that has continued to exist throughout 1883 to present. In fact, if you look at the target of this administration, you will see that you don't have to see it. You hear it from the president's own mouth, where he does not want people to come in from the shithole countries. You remember that? The shithole countries? Africa, Caribbean, Haiti, but they would prefer people from the Netherlands, right? Denmark, Switzerland. He wants people from those areas to come in, which it continue. They use the immigration policy as a way to, in this particular instance, ethnic cleanse. Now I want to go back historically to Nazi Germany. There's a book called Hitler's America, which talks about Hitler coming to the US, observing the immigration policy and saying, wait a minute, this is what I need and I can use to be able to control my community, control my country, targeting others. So you make people the other, which is the Jewish community. You make them the other, you try to deport them. When you cannot deport them, you detain them. And when you run out of space, what do? I am not going to repeat what ended up happening, but we have seen our detention. We have seen concentration camp. You've seen concentration camp, which is my background, right? Which is the concentration camp. In fact, we were fortunate enough to shut down the concentration camp in Tornillo, Texas, where it was in a desert that was meant to hold 13,000 kids. You've seen this administration separating families, children from their parents. Go back to our historical, our Black under slavery. We look at Native Americans. We look at communities when you want to destroy them, what do? You rip apart their families. And that happens right now, targeting our immigrant communities. When you look at, we're talking about COVID and racism. When immigration is so toxic that even our own people, immigrants themselves, have bought into this rhetoric that when you are picked up by immigration, you did something wrong. But let's be real. Under the previous administration, over 3 million people were deported. 3 million people. That is not every 3 million people doing wrong. It is a targeting of our communities. It is a targeting of brown and Black communities who, because of the color of their skin, have been living under this trauma, not knowing if they can be safe at home, at work, or on the streets, because everywhere they go, immigration can come and pick them up. Look at the show tonight. Yes.
May I ask you to speak about your own experience? Because you're talking about this, but you've actually lived through this.
I have lived through this. Wow. I get emotional.
If you prefer not to, then that's perfectly fine as well.
I have spoken about my story. It's just because of where we are now, it is so real. The wound is very strong and open and very raw. I've been fighting the federal system since 2000. In 2006, I was picked up by immigration and taken in, spent 2 years in immigration detention. In 2006, immigration ordered me deported. And while I was fighting my deportation, they kept me in detention. Everything you hear about prison, I have been in both federal prison and immigration detention. Everything you hear is as bad as they say it is. In fact, when I was in immigration, they were shooting at us with pepper grenades. Pepper grenades. So it's not just a pepper gun, as pepper spray, but they were shooting, so it had a massive impact in the dome, shutting down the air ventilation, shutting down the water. So we were continually bombarded with this pepper spray. And then when they took us out of the dome, literally dragging us by the scruff of our necks, handcuffed behind our backs, and slamming our faces on the pavement in the rec yard. But when you look at the reason why we allow this to happen, when you've heard the stories, I don't need to repeat the story. You've heard the stories. There's stories happening every single day. In fact, again, I want to remind people to watch the Immigration Nation on Netflix, because it shows the ICE office wanted to have these documentarians embedded with them because they thought they would have the good side of them, right? You will hear our story. But no matter what they are, they have total villains. They are villains not because of who they are only, but because of the system itself, which, as I repeat, is racist. I wanna share, I can continue in that vein, but there's one thing I wanna share as law students, Trina and everyone here who are law students. What is a plenary power? What is a plenary agency, right? Immigration is a plenary agency. Look it up. Everyone who is on this call, Google plenary agency, plenary power. It is absolute power. Immigration is an absolute power, which means there is no review both by legislation or by judiciary. And we have seen that when people who are locked up in right now under COVID, and we know how dangerous it is, it's a tinderbox, but the courts will refuse to look at this case because they say they don't have judicial review. They don't have jurisdiction. You also see that in Portland, where you send these agencies, DHS, CBP. You know CBP is also a plenary agent, and they can shoot you in the back, and there is no repercussions, there are no consequences. So in New York, we repeat.
Circle back, Ravi, in a subsequent conversation and talk about some of those legal issues and drill more deeply into them. But I want to say thank you for putting, what's happening in this larger historical context, right? And also talking about some of the present realities in a very personal way. Cesar, I wanted to build upon what Ravi has been saying and ask you to talk about what's happening with Latinx persons, and more specifically, what's happening in immigration detention facilities. We know that we have a problem with the spread of the virus in congregate settings, nursing homes, in prisons, right? And also in immigration detention facilities. So could you speak more broadly about what's happening with Latinx persons, and specifically with regards to undocumented persons and immigration detention?
Yeah, certainly, Trina. Thanks so much for having me join this call. And I think before I do, I think it's important to pause for a moment and remember that a year ago today, a white supremacist armed with an AK-47 walked into a Walmart in El Paso, Texas, and in search of Mexicans. And he just shot up the place, killed a bunch of Mexicans, killed a bunch of US citizens and Mexican citizens and some Germans, and that is not Nazi Germany. It's not 80 years ago, right? That's a year ago. We all remember, I hope, that moment, and that is just one moment, like so many other moments in which the politics of racism that we're all living through in this particular moment in time manifests in a different way from one moment to the next. And to get to your question, what's happening these days inside the prisons, the Immigration and Customs Enforcement Agency operates on behalf of the federal government. These are exactly the kinds of places that are designed to not be able to do the very things that I'm doing, that most of us are doing. Right? I'm speaking from home. I've been home since the beginning of March, essentially, as have most of us. And of course, the Immigration and Customs Enforcement Agency runs what it calls detention centers. In reality, these are nothing less than prisons. Many of them are nothing more than just county jails, just the very same county jails to which anyone else is taken, from which ICE just rents bed space. Others are standalone facilities that are owned and operated by private prison corporations like Core Civic and the Geo Group and the Management and Training Corporation. Those are the three largest operators in the U.S. And those facilities look, feel like prisons. Guards watch over the people who are forced to be inside there. Movements are controlled. Entry, exit is highly regulated. And when it comes to the precautions that we're all being advised to take with regard to helping to slow the spread of COVID-19, it's next to impossible. And so what we've seen is that since February, when ICE started testing in its facilities, there are almost 4,000 people who have tested positive across 83 or so facilities. We see that right now, the agency is reporting almost 1,000 people who are in its custody, who are either in isolation or being monitored. And yeah, I think those numbers are substantial, but I think it's important to always keep in mind that the Immigration and Customs Enforcement Agency does not have a particularly good track record when it comes to disclosing medical problems, obstacles to accessing medical care, and indeed the spread of contagious diseases. We have just in the last few years seen instances of measles, for example, spreading rather rapidly through the ICE prison network. And so I always take the data that we get from the Immigration and Customs Enforcement Agency directly with a grain of salt, because I find that time and time again there's much more to the story than what we initially hear, and that's happening in the context of a larger pandemic that's playing out, and as you and as others have noted, in which Latinos are being hit quite severely, quite hard. I'm originally from South Texas. My good amount of my family is still in South Texas. I'm still affiliated with a law firm that's based in South Texas, and this is communities in the southeastern tip of Texas, the Rio Grande Valley counties, Starr County, Hidalgo County, which is where I'm originally from, Cameron County, that are getting just slammed by coronavirus cases and deaths. Hospitals have been full for upwards of a month now in some of these, in all of these counties, ICUs as well. In just one day, for example, or just one weekend, this weekend, Cameron County, which has a population of about 400,000 people, reported 1,100 cases. And a couple weeks ago, the weekend of July 19th, Hidalgo County, which has a population of 800,000 people, reported 1,300 cases. Day after day, we're seeing dozens of people who are dying in these communities, and it's not because of the pandemic is this sort of equal opportunity killer. It's because of this narrative of cultural exceptionalism that Angela talked about earlier, that sort of has relegated communities along the border region and in other places throughout the United States that are heavily populated by people of color, to systematic failures that are just being illuminated by this particular moment, and that's happening inside of facilities that are owned and operated by the federal government. It's happening outside in the communities that where people are making their lives, whether it's happening inside an ICE prison or it's happening in a place like my hometown of McAllen, Texas. These are equally problematic developments, but not unrelated developments. The fact that we're seeing so many people of color being disproportionately hit by this disease is not at all a surprise, nor is it a surprise that the immigration authorities are doing a fairly poor job of controlling this disease's spread within their own institutions.
Thank you so much, Cesar. I think that you've pointed to a number of interconnections, right, with what's happening in other spaces that we've been talking about throughout this conversation, right? The question of invisibility. The public can't see what's happening, right, in these carceral facilities. Privatization, right? We have to talk about capitalism, right? And economic incentives that certain entities may have. There's a question of bias, political vulnerability, and then cultural hierarchies. All of this has to be unpacked, and maybe I was too ambitious in thinking that we could unpack it in 90 minutes, but certainly those are some of the themes that are playing out across these different areas. Rinku, thank you so much, Cesar. I'm wondering if you could build upon that analysis and just bring together the disparate ways in which people, the common ways in which people are being affected across, right, these various areas.
Yeah.
In other words, how is what's happening with workers and immigrants and older persons, Black and brown persons, all interrelated?
Yeah, great. I'm so happy to address that question, and I've been so stimulated by everyone else that I'm going to try to, it's going to be a struggle to keep it brief, but I will do my best. I think the thing I want to lift up the most here is how important the storytelling and the quality of our storytelling is to helping people make connections around different constituencies, communities, what they're experiencing and why. So one really critical thing is that as we look at the disproportionate impact on many different communities, it's really important to step away from the data a little bit, even though that data is super compelling, especially to those of us who already believe. What the data by itself does not do is explain the reason why this is happening and the implications of a community being hit this hard. And if we want to figure out the reasons why, quite often the first step is to follow the money, to follow the money on the road to policies, so that you can see how policies like the one that Saru mentioned, you know, how tipping came to be the wage framework for the restaurant industry, really because the industry was still, because they didn't love emancipation and wished to be back in another era. You know, I've been looking at the meatpacking industry because I'm in Texas, and that meatpacking plants were the origin of outbreaks here in Texas, many of them. And you can see that 87% of the people who got sick are Latinos, but they're only half the workforce, less than half of the workforce. The rest of the workforce is Asian and Black and white, but Asian and Black largely. So if you do a follow the money in the meatpacking industry, you're going to find a ton of deregulation. It's one of the least regulated workplace situations that you can imagine, particularly given that we are eating meat and consuming the things that come out of those plants. So so when we look at all our situations, part of the story has to be that there is institutional action and inaction that affects our communities. And when different institutions interact, that's what we call structural racism. When 2 different kinds or 3 different kinds of institutions layer their effects on top of each other, then you get structural racism. And it, you know, one implication is that you then kind of have to fight all 3 institutions at the place where they intersect. So just another quick word, I spent a lot of time in New York City, and in the city, what we saw was the death rates were much higher in the outer boroughs, so Queens, Bronx, Brooklyn, less Staten Island, but even there. And anyone who's been to New York City knows that the setup is that Manhattan is where the richest people live, with a little bit of creeping into Brooklyn. But it isn't where the people who serve the richest people can live, because there's no affordable housing. So the combination of real estate practice, banking practice, and transportation policy creates a scene where, in order for essential workers who have been deemed essential both by the Department of Health and the Department of Labor, they have to get in New York City onto jammed public transportation because they don't live near work. They couldn't live near work. They couldn't afford to live near work. So, so an important part of the story is being able to look at multiple institutions and their effect on multiple communities. And that makes it so important to apply a race and gender and disability and class and nationality status or lens, looking at all those different kinds of statuses, apply multiple lenses to any problem we're trying to solve, because that's how we are going to be able to solve that problem for everyone, not just for the people that lawmakers are trying to protect or that employers are trying to appease. So multiple lenses, adding a new lens doesn't wipe out the old lens, but it does give us the ability to see all of the nuances in the reasons, the causes of this kind of disproportionality and uneven pain and sacrifice that we're making, so that we can in fact make things better for all.
As a critical race theorist, of course, I'm committed to narrative and storytelling, because it allows us to render visible that which is often invisible, which is people's experiences when they are located on the margins or in invisible spaces, right? So through narrative, we can somehow share those experiences and hopefully build empathy, right, with regards to those experiences. But you also talked about structural inequities, right, and how we begin to unpack these structures: housing, employment, access to healthcare, right, transportation systems, income, benefits, and so on and so forth. So I would like to invite all of the panelists back together now and ask you, when we think about these structures that Rinku and others have been alluding to, could you offer one suggestion, right, for our students and others who are engaging with us tonight in terms of how we might begin to address structural inequality? And how might the persons who are listening to you assist with this effort? And I have to apologize to all of you and to the participants, because we only have 9 minutes left to do this really important work. I was riveted by what everyone was saying. Maybe we can consider this a survey, an overview, and you can each come back and we'll have an hour-long conversation to drill more deeply into each of your areas. So let's start with you, César. One policy recommendation, and how might those who are listening assist with implementing that policy recommendation?
Yeah, I think it's important to keep in mind that the Immigration and Customs Enforcement Agency could just release people who are in its custody. That would go a long way toward allowing for the distancing, mask wearing, hand sanitizing, and isolation of symptomatic individuals that the rest of us who have control over our daily lives are able to do. And for those of us who for everyone who's watching, I think as future lawyers, remember that ICE always has that power. As people who are engaged citizens of this experiment in self-governance that we call the United States of America, I think it's important for all of us to demand that our legislators know that, and to make them aware that we are clear that ICE has this power and can do so now.
And is there an organization where participants might, an organization through which they may direct their voice that you might?
Yeah, I'd suggest taking a look at the work of Detention Watch Network, an organization called Mi Gente, and then of course following the wonderful leadership of people who are on this call, like Ravi Ragbir.
Thank you so much. Nina?
Sure, as a policy matter, I think the key priority is to provide public payment for long-term care in non-institutional settings and eliminate rules and systems at the state and federal level that force people into institutional settings. But for law students and people on this call, I think the single biggest thing you can do right now is not throw older people under the bus. Too often, I think ageism gets a pass because older adults are seen as already having gotten their due, and it's time for other people to have an opportunity. But when we do that, it really legitimizes this notion that shortages of resources are legitimate, even when those shortages are artificially created. And it makes those shortages more politically palatable, and it reduces the political pressure that we need on policymakers, on politicians, to create systems that meet the needs of all people. So don't throw Granny from the train.
Ravi?
Yes. Migration is a natural process. And we shouldn't only be, when we talk about immigration reform, that I don't believe in that. I think we need to throw the whole bathtub, the water, everything, because we shouldn't only be talking about now, we should be talking about future migration. We all talking about climate refugees. We have seen it happening. We saw it happening in New Orleans. We saw many ways that people are being displaced. So we should be looking to change how we view migration and creating a safe passage, safe way for people to move back and forth, whether they want to come temporarily or permanently. So this immigration system right now in the US has to end.
Angela? Thank you, Ravi.
I would say a couple things. I'd say on an individual level, I think on an individual level, one of the things that I think students can do and people can do is really begin to really engage in really deep reflection about their own privilege or disadvantage and act on that in ways that may begin to do some of that. And I want to give a shout out to one of my incoming students, incoming first year student, Douglas Moe, who's an Asian American student who wrote a wonderful piece with his brother about the model minority myth and how that gets employed against others, and how the various disparities that are seen now, not only with COVID-19, but more importantly with police brutality, looking at police brutality, how that sort of exposed to him some of the various privileges that he had and how that is going to affect his behavior going forward. And I think that kind of deep examination on an individual level is really important for the day-to-day things that we do in our lives that might affect change on an individual level with people who are our neighbors, who are our colleagues, who are our coworkers, all those things. On a broader level, on a more structural level, I think thinking about the ways in which disadvantage is built into the systems. Whether it be, providing the kind of support structure that people need to be able to engage in their lives. So whether it be our system, our eviction system, which I think so many people have written about, the ways in which people can get evicted and the ways in which that can really turn people's lives all about and really keep people completely just immersed in poverty and make it impossible to climb out of it at all. I think
Okay. It's difficult to rein in a dean.
Oh, sorry. I'll stop.
We have 3 minutes left.
Everything from housing to childcare. I mean, what we see is that those things, losing those things, healthcare, all those things, that those should be broadly supported for all people. And we see the impact that it has on middle income and upper middle income people to lose those things. And so imagine people who are much more vulnerable. And we should be providing that kind of support for everyone.
Okay, as one of my dear friends, I'm sure you'll forgive me.
I will absolutely forgive you.
Thank you. Saru?
Hi. Yeah, 2 key policies that we should be fighting for right now. One is obviously an extension of unemployment insurance that is provided universally to everybody regardless of their prior income. And 2, what we call one fair wage, a full livable fair minimum wage for everybody in this country, regardless of whether they were tipped or incarcerated or disabled. Everybody in this country needs to be paid a full minimum wage. If this moment didn't show that that's the case, I don't know what moment will. And if employers are willing to do it, for God's sakes, legislators need to follow. So let's have everybody who's listening call your congresspeople and especially senators and tell them we need an extension of unemployment insurance and we need one fair wage, $15 full livable fair minimum wage for everybody who works in the United States.
15 or 25, just putting it out there. Rinku?
I'm going to go with fighting for immediate eviction moratoria. And I think in any city that the students on this call are in, there's a tenants union of some kind that I guarantee is fighting on that issue right now. I think eviction moratoria and support, particularly for small landlords, there are lots and lots of mortgage holders and folks who are just renting out like their basement apartment. They're not enormous housing conglomerates that have a cushion. So I'd say look for your local tenants union, help them fight for a moratorium on evictions. And I really love the journal Shelter Force for keeping track of debates and housing, which I frankly think is one of the, is an arena of racial justice that deserves a lot more scrutiny and support and attention than the movement as a whole gives it.
Thank you. And Ted, would you take us home? Because you were the person, if I recall correctly, who seemed to, and Saru, because there is change happening in unexpected space and places, right? You seem to exhibit the most optimism about transformative change in the future. So you've heard about all the work that needs to be done, right? From unemployment compensation to addressing the eviction crisis, which preceded the pandemic, which has been as exacerbated by it, to changing the immigration system. What's your?
Well, let me first say that there are moments in which I have to really fight hard and consciously against despair, because there are so many reasons for us to despair. And as corny as this sounds, and I hear other people saying it, I've been saying it too for a long time, I came to realize some time ago, it does sound corny, but it's also true. Hope is not something that comes to us serendipitously. It's a choice. We choose hope in the face of all the reasons to be hopeless and in despair, because to do anything else is unpalatable. It's to lay down and die, and we can't do that. But there are reasons also to be hopeful in this moment. I do think, as I said, we have more people, including white people, engaging in introspection about white supremacy. I have friends who tell me, don't fall for the okie doke. You know, we've been here before. It's not going to happen. But I don't, you know, I don't choose to look at it that way. All the policy recommendations that we've heard about, you know, eviction moratoriums, living wages, all of these things are important. And I think personally, we've all got to, we've got to do the things no matter what, you know, the occupant says and other people who support them. We've got to wear masks. We've got to socially distance. We've got to be personally responsible in so many ways. And so, you know, and as individuals, we have to challenge power. You know, we have to challenge people who are entrenched in their power. The last thought that I think I want to share, I hope this is my last thought, I know you do, is I look at everybody who's on this Zoom call, whose faces I could see, and it doesn't escape me that you know, I'm the oldest person on this call. I'm the one who people talk about. You're talking about me when you talk about senior citizens and people who are vulnerable. That's me. And, you know, it's come more quickly than I thought. I'm not ready to leave here. So when I hear you all talk about, you know, valuing, you know, older people, I'm glad to hear that. But I think that the most important thing is that what we're seeing right now in this movement, and this truly is a movement that we've seen for the last months. And like any movement, you know, it's bought and paid for in blood. It doesn't come easily. But this is transgenerational, it's transracial, it's transsexual, it's trans-religion, it's trans.
And
Yeah.
let's hope that it's transformative, right?
Amen.
I really appreciate what. I'm sorry. Go ahead, Ted.
I should stop right there. Yeah.
I just want to underscore what you said about choosing hope, right? It's a choice. And you also choose to act, right? Choosing is a problematic term, but we choose to act. And all of you, Rinku, Ravi, Ted, César, Nina, Angela, all of you chose to spend your time here with us tonight, and we're deeply, deeply appreciative. I hope that you will come back and engage in another conversation with us so that we can drill more deeply into these really important questions about equity and about people's lives. So thank you so much, and thank you to all of the attendees. I also want to thank our team here at Duke Law, my research assistants, Andrew Lindsay and Andrea Guzman, who had the idea for this webinar series, and Isabel Fox and Rachel Greasom and Miguel Bordo for their amazing administrative assistance. If those of you who are listening and watching want more of these seminars, just let us know, and we'll be happy to do our best to arrange them in this really important moment where information is truly powerful. Take care, everyone. Be safe. Wear your mask. Bye-bye.